Today's episode is for the women who want children someday but aren't ready quite yet. Perhaps you're in your late teens or your early to mid 20s and you're focused on college and beginning your career, and you want children someday, but it's not time for that yet. You don't yet have your spouse, or maybe you are married, but you are focused on traveling and aren't quite ready to start a family yet. Wherever you may find yourself, today is for the future mothers. And here's what I want you to hear: you do not have to be ready for children right now to start supporting your fertility. Fertility is not just about getting pregnant, it is truly a vital sign of health. Today, we're talking about cycle literacy, fertility awareness, and why learning your body now changes everything later. From a personal standpoint, I had one cycle a year throughout high school. It was the break between track and cross country season. And in college, it started the same way until I studied exercise science and nutrition and started applying those principles to my own body, was able to regulate my cycle. Fast forward to getting engaged and married, and I was able to chart my cycle, as we'll talk about with my guest today, and was able to get pregnant our first cycle trying. And if I hadn't addressed those early signs of infertility in high school and college, then it's crazy to think where I could be now. And now I have four children. So today I am joined by Olivia Chastain. She's the director of Sympto Pro Fertility Education, a symptothermal method that has been helping women understand their bodies since the early 1980s. Olivia, thank you so much for being here. Could you tell our community a little bit about yourself before we dive in?
Yeah, well, first, thank you for having me on. I'm always happy to be invited on to chat about SymptoPro. Um, so for me, I guess I got into this because I had kind of been disenchanted with the whole medical field of things for other reasons in my health. When it came to gut health, I had like terrible digestive problems growing up, and the mainstream medical community never had answers for me. They basically always told me it was in my head, and like it got pretty severe to the point where I ended up with a colonoscopy at age 19, and like these symptoms are not just in my head, they're real. And I just for me, that was kind of like, all right, I need to start trying to take care of myself, kind of do things on my own, because I didn't feel like I was getting the answers or support that I needed from the mainstream medical community. I had similar story with my cycle as a teen and being super irregular and just not having the right tools in the toolbox from the medical community. And so later on, when I actually learned Sympto Pro through marriage prep. As a Catholic, I was required to take it when I was in marriage prep, but it opened up a door for me. And to be able to see this and learn to understand parts of your body and what that means, it just made such a difference for me that it was like this missing piece that wasn't there throughout, my teen years and childhood when I was dealing with all of these issues that weren't being addressed. So that's what really got me passionate about this, and why I ended up diving into the role as becoming the director of Sympto Pro.
I love that. I too am Catholic. And when my husband and I were engaged, we went through natural family planning courses. So, for those listening, there are multiple methods out there. We can kind of get into that too to track your cycle. And that is something I recommend starting right now, whether it's with the Sympto Pro method or the NFP method, which is natural family planning. There are different variations. And sometimes it's finding what the right fit for you is. And you can chart these in apps or paper charts, and we'll go through all of that today. But it gives you literally the fifth vital sign for your body to understand, am I fertile, but also am I in optimal health? So, Olivia, what is the symptothermal method?
Yeah. So Sympto Pro, like you mentioned, is a symptothermal method. And symptothermal means, if you break down the word symptothermal, what we're going to be looking at is your symptoms of fertility as well as your thermal temperature. So, symptothermal methods will usually chart cervical fluid, because your cervical fluid changes throughout the course of the cycle. And that changes based on fluctuations in estrogen and how your hormones shift as you lead up to ovulation. And then the thermal part is tracking your basal body temperature, which is your lowest body temperature. It's usually what you would take right away in the morning before you get up and start moving around, and your body temperature then rises. But that temperature also shifts in relation to your hormones, because after ovulation, your progesterone rises, and progesterone causes your body temperature to increase. If we think about progesterone kind of being the progestation hormone, is what would be preparing your body for if you were pregnant. And whether you're pregnant or not, your body's going to create progesterone, and that's going to cause an increase, a slight but noticeable increase in your body temperature. And so if you're tracking your temperature every day, you can see that shift. And then you can know at what point you are past ovulation. And your body does that because if you would happen to be pregnant, just makes your body a little bit cozier for that baby that's growing. So
And how do you recommend women test their temperature in the morning? So I remember back when I was in college, I had one of those under the tongue ones, and it would read out to 2 decimal points is what we want. But you have to take your temperature around the same time every morning. Otherwise, it can throw off results. And as a typical college student, I would get up early during the week, but sleep in more on the weekends. So do you have any like latest tech recommendations for women out there in terms of taking their temperature?
yeah. So the original suggestions in terms of what the research is based on is still based on those oral thermometers. So it's just going to be the cheap thermometers that you can get at a drugstore. Well, it's going to be a basal body temperature thermometer. And to know the difference is when you take your temperature, after the 1 minute beep, does the temperature read keep changing? If it doesn't change and it's just like the quick read where it beeps and then the temperature doesn't keep reading, then it's not the right one. So you want one that is going to continue to take your temperature, because you really want to take your temperature beyond that 1 minute beep, because we're looking for very minute changes in terms of what the temperature shifts look like. Um, but in terms of wearables, they're actually, I mean, um, again, you're going based on this new technology that doesn't always necessarily have the research behind it in conjunction with family planning methods or symptothermal methods. So you are deviating from what that research suggests. So it's hard to say for sure that this is going to give you the same effectiveness rating. But among all the different wearables, the one that kind of stands out as being the most likely to give you an good effectiveness is Temp Drop, which is an armband wearable, so it's closer to your body core, so it's going to give you a better idea of what your core body temperature is versus like the Aura Ring, which is on your finger further away. Yes, you're going to have more temperature fluctuations. And certainly, there are women who do choose to chart their temperature using the Aura Ring. And I'm not going to tell them they can't. My job as an instructor is I'm going to help them optimize that use to see if it's actually going to be effective for them before they start relying on that. And what that might look like is if you know you're going to have irregular, wake up times, maybe you chart an oral temperature alongside a wearable for a cycle or two. And then you can see, are your patterns similar, or is, the wearable way off of what the oral thermometer looks like? Because if they're similar, then it gives you that confidence level that, okay, this is actually picking up and detecting these small temperature shifts in my patterns. But if they're way off, then this is probably not the best choice for you.
I love how you phrase that because I know for some people Oura Ring works great, and my husband actually gifted it to me about a year ago to assist with cycle tracking. We had my 3rd child had just turned 1. We wanted a longer gap between our 3rd and our 4th, and he was like, "This can help maybe talk your temperature or whatever." And so what's funny is I immediately just switched, and I know better, but I just switched what I was doing and only followed like Aura Rings, notation of my fertility within that app, and we got pregnant that very first cycle, and we were
Right.
intending to avoid pregnancy.
Oh, man. Yeah.
So, thus came along our 4th child, but all in God's timing, it's wonderful, it's all good. However, if you very much are trying to delay conception or want to really zero in on that fertile window, just as Olivia said, make sure before you switch which method you're using to potentially track your temperature, you're tracking it alongside what you've been using to make sure it is accurate. And for some people, it can be accurate, but for me, it was not.
Definitely. And like I said, for the wearables, I would definitely prefer if clients go with Temp Drop, just because again, it's closer to the core of your body. I mean, I mean, I know when I sleep, sometimes my hand is underneath my pillow, sometimes it's not. And so
Mhm.
just my finger itself is going to be warmer than other times of the night. And those are shifts that are unrelated to my fertility, just based on where my hand is placed. Um, Another great thing about Temp Drop is they did, I mean, they're co-authored on the study, but they did just release a study comparing their temperature shifts and what the app their their algorithm, I guess, picks up, in comparing it to the urinary hormone metabolites, so the clear blue monitor, and it was comparable in terms of being able to detect when that shift happened after ovulation. So they now have some data in terms of backing up how effective they are at for specific markers of fertility versus without having that data, they don't necessarily like have the effectiveness rating that's there. And I mean, Temp Top really was designed for the fertility awareness space versus like Aura Ring, I think was originally developed for tracking sleep. So
Yeah, yeah, an activity, and it does all of the other things, and so if it's a catch-all, it's not gonna be as optimized in that one thing, so yes, that's a very good point. Now, what are the actual biomarkers women are observing when using SymptoPro or when using a type of symptothermal method?
yeah, so, well, as you had mentioned, there's different types. So the like mucus only methods are for women who are just tracking their cervical fluid. And what that looks like is when you're wiping, when you go to the bathroom, when you wipe, there is mucus that is produced during the course of the cycle, and that is in result of because of estrogen. As estrogen rises, your body produces healthy cervical fluid, and it initially might look like, sticky white mucus. And then as you get to the point where you're closer to ovulation, it should look more clear. And we call it raw egg white. So it would look clear like a raw egg white, and it gets like stringy. And that doesn't mean you have any type of infection. That's a normal biological process that happens for women. And the purpose of that is this stringy raw egg white type mucus that's produced because of the estrogen production actually helps facilitate sperm traveling to the egg. So without that, it's actually harder to get pregnant. So if you're not producing any of that cervical fluid, it can be harder for you to get pregnant. So what you're tracking is those small shifts in the cervical fluid production that you check before and after you go to the bathroom. And then you're checking the basal body temperature. And with Sympto Pro, we also do teach women to track sensations, which is just vaginal sensations throughout the day. Sometimes that might feel like it's it's kind of weird to talk about it, I guess, for someone who's not necessarily trained in it because it sounds kind of woo-woo, like just but there are things that happen throughout the day that you don't notice until you develop that awareness. For some women, it might feel like a bubbly sensation, I guess, like little bubbles popping. And other than that, we also do teach women to track their cervical position. And that is because inside the vagina, the position and the feel of the cervix actually changes throughout the course of the cycle. It can go up, it can come further down, it opens, it also closes. So, tracking that in relation to your cycle can also give you a better idea of where you are in your cycle, which helps you make decisions based on if you're trying to avoid a pregnancy or if you're trying to conceive.
Love it. And let's talk for a minute about why ovulation is the key event and not just bleeding. Because so many girls in high school and college, when we think about our period, we just think about bleeding, right? We don't think about the cervical mucus or ovulation at all. But then when somebody goes to try to conceive, that is so important, right? And there are biomarkers, to your point, that we can look at well before we're ready to have children that will give you indications to your fertility. So, why is ovulation the key event and not just bleeding when it comes to a menstrual cycle?
Right. That definitely ovulation is honestly it's the big event.
Mhm.
Everyone thinks, especially if you're not tracking, you only really notice your period because that's what's obvious. Whereas ovulation is not obvious unless you have been taught to track these specific biomarkers. And ovulation is the purpose of why you have a period. So if you do not ovulate, you do not have a period. You could bleed and you might think you have a period, but if you're not ovulating, that's not actually a true period. And the, the reason why your body is doing this is because your body is releasing an egg. That's what ovulation is. Your body has released an egg for the purpose of either you're going to get pregnant or you're not. And that's what ends up in your period is as your body is shedding this uterine lining, this egg is also being shed with that. And really your period is just like, if we call it like a report card for how your
Mhm.
past cycle was, how
Yeah.
how healthy was your ovulation. If your ovulation in the past cycle was not healthy, well, you might have a really painful period. You might have a really long period.
Mhm.
You might have a really short period because sometimes that happens too. And it really does give you a key as to what has happened in this past cycle because that's what we're seeing in the period, but it's really what happened at ovulation that made the difference.
Yeah, and that's so important to understand. Now, many women in their early 20s are placed on hormonal birth control or, in their teenage years are placed on hormonal birth control without ever being taught what cervical mucus is and what it means, how basal body temperature shifts reflect progesterone and the body's ability to conceive, that irregular cycles are not normal, and that putting them on birth control is really just a band aid approach. And also that PMS is a signal and not a personality trait, right? PMS is truly a symptom that something is wrong as well. Now, when we suppress ovulation with something like birth control, we're suppressing data, we're suppressing the body's symptoms or the body's signals that are telling us that it needs help, that something is off. Now, for women who want to optimize fertility down the road, we need this data to help get to the root cause of what is going on. So, what does a healthy cycle actually look like?
Yeah, that's a very good question. For those teens that are just starting, it is normal to have irregular cycles for the first 1 to 2 years as their HPO system is becoming mature and their body is getting into this rhythm of what it means to cycle. So it is normal to have irregular cycles for up to 2 years. So if you're just starting out and you have irregular cycles, it doesn't mean that there's something wrong. It means that your body needs time to work this out. But beyond that, if your cycles don't fall into a pattern that is much more consistent, where you are cycling, like if your period is longer than 35 days, if your period is coming more often and it's like less than 25 days, that those are signs that your body is, and that's without doing further tracking. But if your period is coming more often than 25 days or longer than 35 days, those are signs that something is off. And that's once you are beyond those initial 2 years, we really do want you to see a better pattern there. And then when bleeding happens, is your bleeding like 2 days long? Because that's pretty light for a period.
Mhm.
And but then on the opposite side of that, are you getting to the point where you are past 7 days, past 8 days? Then there again might be a sign of certain deficiencies in your hormones, or maybe that your estrogen's really high and it's causing this heavy bleeding that's just going prolonged like this. Um, so having that data and being able to track that from looking at historically what your periods looked like is so important because when you go into a doctor's office, whether you're seeing a functional medicine practitioner, whether you're seeing your conventional OBGYN, doesn't matter where you're going, but when you have that data, you can use it to help get to what the underlying root cause is because you can say, this is what I'm seeing. Or, like in the case of PMS, if you're tracking when you have those mood shifts in the
Mhm.
course of your cycle, you can use that to diagnose, okay, this is PMS versus I might have just an overall mood disorder if you don't realize that this is only happening at a specific point in your cycle.
Right. And how that can lead to misdiagnoses or women put on pharmacological drugs that they don't need for anxiety or depression if it really is actually the root cause that it's uncontrolled PMS, right? Because their hormone levels are off.
Yeah, yeah, and especially with some of those options, they're so hard to come off of, and it's like if you were
Yeah.
put on this drug that's very hard to come off of mistakenly because that wasn't the underlying issue,
Right.
it's just, it's really hard for, I mean, myself included, I was put on birth control as a teen for irregular periods, and the to learn as an adult the side effects of that, and that I it didn't help. If anything, it made things worse because you can't regulate a cycle by giving yourself a drug that causes a hormonal imbalance. It works to prevent pregnancy by causing a hormonal imbalance. So it will not correct a hormonal imbalance by making it worse. Like it truly is a band-aid solution, and it really only deals with the current symptoms that you are seeing, and it does not correct anything beyond that. So it's really hard as an adult to see other people doing that, knowing that they're only making these decisions because they don't have the full picture of what's going on.
Right. And if you are somebody who's currently on birth control and wanting to get off, or if you recently got off birth control and did so kind of cold turkey without any guidance, go to my blog, drkaylaborchers.com/blog, and search for birth control. You'll have a blog post and podcast episode pop up that I did with a dietitian that talks all about coming off of birth control optimally, because it drains the body of so many micronutrients and minerals. And so there are so many steps you can take ahead of time to help your body ease off of it. So that episode just has tons of good information for you if that pertains to you. Now, how does cycle literacy empower women regardless of relationship status? I think this is so, so important because of what you just talked about, that it gives you information to advocate for yourself. And so, just can we speak to a moment about the fact that you don't need to be married to track your cycle? You don't need to be engaged to be tracking your cycle. This is data and information that you can bring to a doctor's office, regardless of your relationship status, that will help you down the road.
Absolutely. It really is it's foundational body literacy because you understand your body and your health so much better. And I mean, even just the point of being able to predict when your next period will happen. And not just because, like, you don't have to have 28-day cycles to know that, okay, my period is going to be coming on this day. Like, for a teenager, especially during that time period when their cycles are a little bit irregular and not falling into a more consistent pattern, being able to track when that temperature shift happens and know that, okay, I know that in 2 weeks, because that's how long a healthy luteal phase is, I know that in 2 weeks I can expect my period. That is, it's, I mean, it's priceless. It's priceless information for a teenager to never be surprised by their period. And what teenager wouldn't want that information? Like, what teenage girl wouldn't feel extra prepared if they just had this like magical calculator that could always tell them when their next period would show up?
Mhm.
It's 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 just it offers this information and this understanding of your body that helps you realize that when things aren't wrong, it doesn't mean that you're broken. Like, there is an underlying cause. And when you go into that doctor's office, you have this data to be able to direct what your treatment looks like and to truly, like you mentioned, to advocate for yourself, to be able to say, this is not what I want. Because if you're tracking, you take a pill, that's going to completely mess up what your cycle charts look like because they're not fertile anymore.
Right.
And you can see that difference. And when you're moving actually towards a state of health, whatever you're doing to support your health will show up in terms of results on your charts because you'll be able to see that difference. So if you're taking a supplement or a medication, or you're doing lifestyle changes, even
Mhm.
just that, if you have fallen onto what the key factor is and what is really going to support you there, you see that difference in your charts. And I mean, there's no better way to say, all right, I found the right thing because you can see it with the data right in front of your own eyes.
Yes. I had a woman reach out just this week who just got engaged, and her fiance are taking the Creighton method through their church. And she asked if it was okay to still do my preconception program, which is all about lifestyle changes, optimizing exercise and nutrition for fertility. And I said, absolutely, start charting now because you want those baseline numbers, that baseline data. And then to your point, you can see how those positive changes affect your fertility. You might notice that, okay, my cycles are now more consistent, more regular, or oh, now I'm noticing more abundant cervical mucus than I was before. Like, it's amazing to notice those changes and what simple lifestyle changes can make. But it's not just throwing, the kitchen sink at things. It's following like a guided professional in terms of that to really understand what is going to affect fertility markers. And so that's what I share in my preconception program. And it was fun to just have somebody reach out this week about that.
Right, and it really is so cool to be able to see that because, I mean, especially if you're starting to chart before you ever need it for family planning purposes, it really gives you that courage that, "Wow, I can see this temperature shift. I can do this. I understand my body," and it gives you when you get into the point of when you're ready to have kids, it just gives you the courage because you already know yourself so well that it becomes easier for when you do want to try to conceive, and you don't have the same fear around it because you just truly understand yourself.
And it's positive feedback of, oh, wow, whenever I cut out, toxins in my environment, I notice that my cycles are more regular and I have better cervical mucus. It's that motivation to keep going and to keep making better healthy lifestyle choices for yourself. And you get that immediate feedback to know that it's working.
Right, right, definitely.
Now, what are common misconceptions about fertility awareness based methods?
No, I love this one. The most common is definitely that it's the same as the rhythm method. And modern methods of cycle tracking are so much more effective. They have a lot more data behind them in terms of the specific biomarkers that you're checking. And we now know for these different methods, we can tell you what a typical use is versus the typical effectiveness rating versus the method effectiveness rating. And this is really important because so the method effectiveness rating, the studies will tell you if you are someone who's going to follow all of the rules to a T, what is the effectiveness when it comes to preventing pregnancy? And for most of our modern methods, so when we talk about, like you mentioned, Creighton, that's a mucus only method where they're just charting the cervical fluid patterns. Um, and then there's also the Marquette method where they track the LH hormones in conjunction with the cervical fluid patterns. So those are kind of the three main types of methods. So the mucus only, symptothermal, where we track the basal body temperature, and then the symptohormonal, which is with the LH strips. And between all of these different methods, the the method effectiveness rating is like 98% effective, roughly around that, give or take a little bit for the different methods. But I mean, that's actually more effective than the birth control pill.
Mhm.
But then we have what's called the typical use effectiveness rating, and that is what it looks like in real life. Because when you are charting, you understand that not everything is black and white, and there's a lot of gray space. One, what if you didn't follow a rule correctly and you maybe bent the rules a little bit and you now find yourself pregnant? So that falls into the typical use where you're not the person who's following the rules completely to a T, and that gives you a different effectiveness rating. But even the typical use effectiveness rating is still roughly in line with what the birth control pill is like for
Wow.
most of the methods. But when you compare that to what the historical data we have for the rhythm method, where you just assume that you have a 28-day cycle, you're going to ovulate on day 14, um, that effectiveness rating is only around 77%. So when you see that number touted by some, mainstream news articles or, listed as the lower rate on the CDC for effectiveness rating for natural family planning methods, that's because that is the rhythm method. Okay. And these modern methods are not the same as the rhythm method. They are based on a lot more data, a lot more science. We have a lot more research to back up these biomarkers. And they're significantly more effective, especially when you compare them to the birth control pill.
Can you speak quickly to what the rhythm method is, just for those listening who aren't sure?
Right. So the rhythm method was kind of like the precursor to modern methods of natural family planning. And it assumed that for the vast majority of women, you had a 28-day cycle and that you were going to get a period every 28 days and that you ovulated on day 14. Because that, again, that luteal phase, a good healthy luteal phase is pretty much consistently 14 days. And that's the second half of the cycle that happens after ovulation. So it assumes that you ovulated on day 14, and then you're going to have this 2-week period or 2-week stretch, I guess, before your period shows up. And so for the rhythm method, what couples would do is they would avoid having intercourse on the days around ovulation. So around that 14-day mark, they would avoid in the days leading up to it and a couple days after that 14-day mark. And then they would choose to have intercourse at the early part of the cycle and then after the point in which they had ovulated. But if you are a woman that does not have a 28-day cycle or does not consistently ovulate on day 14, even if you have a 28-day cycle, which by the way is only like 13% of people, 13% of women. So it's certainly you're not in a minority if you don't have a consistent 28-day cycle and ovulate on day 14. But if you are, if you fall into one of those categories, then all of a sudden you are avoiding intercourse on days that might actually not be fertile. Let's say that you ovulate on day 18. Well, maybe that's the point when you had resumed having intercourse because you assumed that you were past ovulation. And now all of a sudden you get pregnant. Well, yes, this is why the rhythm method does not have a very high effectiveness rating because you're not actually charting any biomarkers. You're not actually seeing your own rhythms and patterns. You're just going along with the assumption that you are infertile on these days and this is when you expect your period.
Thank you for sharing that because I think that's really important to understand that obviously that is not using as much science-backed data and tracking to analyze for you individually, and so it's no wonder that those numbers are more off. And it's very unfortunate that mainstream medicine goes to those numbers when recommending, how to delay or space out pregnancies after somebody has just had a child because these natural family planning methods are usually not mentioned at the doctor's office whenever you go in for that 6-week postpartum check and they want to jump straight to, an IUD or something that you insert into the body or birth control, which is a completely different conversation from, what we're focusing on today, but just something important to note.
Right.
Now, from a root cause perspective, ovulation requires adequate energy availability, healthy thyroid function, balanced cortisol, which is your stress hormone, so if you're really stressed out, it's not going to be balanced. Sufficient micronutrients and nervous system safety. And so we talked about the importance of ovulation and that a menstrual cycle is not just the bleeding as the main event. The main event really is ovulation. And in order for that to appropriately occur, it needs all of those things in place, which if we're thinking about the three-sport high school athlete or the stressed out college student who is trying to get into a doctorate level program with her grades, it's no wonder so many women are struggling with cycle regularity and perhaps are not ovulating and that our infertility numbers are on the rise. And so this is why we wanted to do this conversation today because it's so important to start tracking this now. Because if you are a woman in her early 20s or in your teenage years and you're chronically undereating, maybe you're not trying to, but you're just not quite fueling your body appropriately. If you're overtraining or over exercising, maybe it's for aesthetics or maybe it's your, where you let steam off. It's so your way to de-stress. But if we're overtraining, undereating, sleeping poorly, which is many of our college students, and living in constant stress, then your cycle will tell the story. Your cycle will show in your biomarkers that something is off. Now, Olivia, what are some early warning signs that you'll see show up in cycle charts when some of these root cause behaviors may be going on?
Right. So, as you mentioned, the stress piece, and this is actually, I think, really where another piece where charting is so helpful. Because if you have a particularly stressful cycle, you see the changes in your chart and you can know, okay, like I've had, like, let's say I have tests coming up this week, exams coming up for school. And all of a sudden your chart's prolonged and your cycle is longer, you can see that shift and you can help attribute it to what the cause is. Why is this happening? You can talk with your instructor, like if you learned a specific method, and they can help pinpoint, okay, are you under more stress than you normally are? Or maybe you missed a few nights of sleep, had a few late nights, and all of a sudden, again, often what we see is the cycle will prolong. And that's because the body is having a harder time getting to the point of ovulation. Because again, like you mentioned, it takes all this energy. We have to have good mitochondrial health in order for ovulation to happen optimally. So when the body is under stress, what will happen is ovulation will get pushed further on down the cycle. Or if you are already past the point of ovulation, that might show up like all of a sudden your progesterone levels are kind of tanking up and down and you get kind of PMSy. Or maybe you start spotting before your period versus having just like a healthy onset of your period. You're spotting for a while beforehand because your hormone levels are not where they need to be. Other things that can show up are, you mentioned thyroid function. So don't take your basal body temperature and expect that you're going to have 98.6 as your temperature. It really is going to be lower because it's the lowest point of your temperature. But if you are consistently taking your temperature and you see that it's very often like 97.3 or even into the 96, like 96 point something, if your temperature is like that consistently, it can be a sign that your thyroid level is kind of sluggish. Your thyroid's not functioning optimally. And again, that's something that you can take that information and you can go to your health practitioner and say, look, I want to get my thyroid levels checked because my basal body temperature is really low. I'm having heavy bleeding. That can be another side, especially if you're having multiple signs. Like if you have heavy bleeding, your basal body temperature is low, your cycles are a little bit irregular. Those are all signs that your thyroid is struggling. Other things that can happen are, what if your cycles are truly just really dry and you don't see any of that healthy cervical fluid that we talked about? That can be a sign that your estrogen levels are really low. And why might your estrogen levels be really low? Well, are you working out all the time? Are you not eating enough to fuel your body? Like, are you chronically under eating? Where we talk about, if you've heard of the term, oh man, I can't, it's just escaped my mind. But the
Like reds, rel
yep, that's another one too. Yep. REDS, the relative energy deficiency in sport. Yes. And that's where you're not eating enough to fuel your body. But this is
Mhm.
essentially what leads to hypothalamic amenorrhea, where your body doesn't have enough energy to support this hormone production, and then you don't get your period. So that can look like really dry cycles. And that can be because you're not eating enough. It can be because you're exercising too much. Um, Both of those, even slightly in combination, can also lead to the same thing, where your cycles are just going to be prolonged and really dry. And those are signs that your body's asking for help, because this report card that we talked about is coming with your period. And when you're tracking all these different biomarkers and you have that chart in front of you, you can say something's wrong. Something is wrong, and I need to do something else to support my health in a better way.
Yes. So perhaps you're listening and thinking, this feels like a lot. I'm 22, and that's okay. But here's what we want you to know: learning about your body is never wasted. It builds body literacy, confidence, self trust, and medical advocacy skills. And one day, whether you want children or not, you will be so grateful you understood your physiology instead of outsourcing it. So, Olivia, what does getting started with Sympto Pro look like? If somebody is listening, they're like, okay, I want to learn my cycle, but I feel really lost. Do you guys offer mentorship or course? How do they get started?
Yeah. So we have a client course, and it's broken down into 3 sessions just because there is a lot of material to cover to go over. So with this, if you go to our website, you can either find an instructor if you want to take the course in like a live format, like over Zoom or something like that. But they're going to meet with you 3 different times. Um, otherwise, you are Otherwise you can sign up for our on-demand course where you're watching videos. But either way, you're still paired with a real instructor, so you have a real person, not AI, not some algorithm. Like, you have a real person to ask questions to. You are set up with that instructor, and you learn the material in these 3 different sessions. That's going to teach you how to chart, what to chart. It's going to teach you for these different patterns. It's going to teach you to apply different rules to your charts for if you're trying to avoid pregnancy. And we even, like, if you talk to your instructor can give you the effectiveness rating for each of those individual rules too. So if you want to pick the most effective rules, you can work with your instructor and they'll be able to help you with that. But after those 3 sessions, you still have the support of your instructor. So with a Sympto Pro course, you have support for life. So you could take the Sympto Pro course now. Gain that body literacy and understanding, and then maybe a few years down the road when you're ready to get married or you're ready to have kids, you can reach back out to your instructor and they're going to be able to offer you that additional support that you might need. And there's not, like, if you're just looking for a quick question or a chart review at that point, there's not any additional fees for that. Certainly, we do have a small fee for if you want to have like a more of a one-on-one consultation with your instructor at that point, to ask like more in-depth questions and just really get a little bit more of their ear to be able to find something more personalized for you. But just those basic one-on-one questions, or just those basic like check-in questions, that's all included. You don't have to pay any additional fee for that. And we are truly there to support you because we want to support you in this. This is the benefit of learning the method from a real instructor versus trying to DIY it with a book. And then when you have questions come up, or all of a sudden, like you find yourself with just irregular cycles and you don't know what to do, your instructor has all of this information to be able to offer guidance that's going to be beneficial for you.
That's amazing. And to understand the effectiveness rating difference, as you mentioned earlier, when you follow it to a T versus kind of just DIYing it. And so having somebody to look at your actual chart and be able to communicate back and forth with is something I very much recommend. And this is something that's offered to all couples whenever they go through kind of the stages of becoming a married couple through the Catholic Church. And again, there's different methods out there, but it's so helpful for women to understand you can just do this on your own. You don't need to be engaged, you don't need to be married to actually dive into your cycle, and you can use this information as, a fifth vital sign, as cycle literacy for you, and understanding the rhythm and the methods that God designed into the female body as signals, as symptoms, as information for you to help get to the root cause of whatever you're dealing with. And maybe you'll find like, okay, everything looks great. That's wonderful. That's incentive to keep doing what you're doing then. So we will link Olivia and Sympto Pro's information in the show notes if you are like, yes, I need help tracking my cycle and getting started that way. I will also link in the show notes my Holistically Well Preconception program. That is your place to go to if you are falling into those categories of perhaps over exercising or even under exercising or undernourishing your body, or you're just not sure how to optimize your nourishment for fertility, and then more functional medicine methods for getting to the root cause of some of these common reasons that cycles may be irregular. So that is in the preconception program. I will drop both of those in the show notes so that no matter what season of life you're in, you have resources and tools that you can dive into right away, and you don't have to try to figure this out alone. Olivia, is there anything else for our community today that you want to share in regards to, not delaying diving into understanding your cycle and really using this information as root cause care, no matter what your relationship status is?
My, I guess, final parting words would probably be that if something is going wrong in your cycle and you can see that in your charts, to not give up and to know that you're not broken, that there is a cause. And finding the right practitioner, if you don't find the first one right away, that's pretty normal. But to keep looking and know that you're worth it and that your cycle health is worth it, because you protecting that and advocating for that now will really make things easier for you down the road, especially if you do plan to eventually one day have a family, that doing that hard work now will pay off in the long run.
Yes, I love that. So, whether motherhood is 5 years away or just around the corner, know that cycle literacy is truly foundational for your health. We want you to really thrive in all seasons of womanhood, and we hope that these tools that we discussed today will help you get there. Thanks so much for tuning in. And as always, go ahead and hit subscribe if you haven't already, and leave a review for Holistically Well. We would love to know what is resonating most with you. Until next time, take care and be well.